Up to a quarter of healthcare spending in the United States is wasteful. And trying to fix that's surprisingly complicated. That's the topic of this week's Healthcare Triage. Special thanks to Austin Frack, from whose Upshot column this episode was adapted. Even a divided America can agree on this goal: a health system that's cheaper but doesn't sacrifice quality. In other words, just get rid of the waste. A new study published a few weeks ago in JAMA finds that roughly 20% to 25% of American healthcare spending is wasteful. It's a startling number, but not a new finding. What's surprising is how little we know about how to prevent it. Following the best available evidence, as reviewed in the study, would eliminate only 1/4 of the waste, reducing health spending by about 5%. Because American health spending is so high, almost 18% of the economy, and over $10,000 per person per year, even small percentages in savings translate into huge dollars. And it's bigger than the U.S. defense budget, as well as total primary and secondary education spending. If we followed the evidence available, we could save about $200 billion per year, about what is spent on the medical care for veterans, the Department of Education, and the Department of Energy combined. That amount could provide health insurance for at least 20 million Americans, or 3/4 of the currently uninsured population. The largest source of waste, according to the study, is administrative costs, totaling $266 billion a year. This includes time and resources devoted to billing and reporting to insurers and public programs. Despite this high cost, the authors found no studies that evaluate approaches to reducing it. An editorial accompanying the study suggested that moving to a single-payer system would largely eliminate the vast administrative complexity required by attending to the payment and reporting requirements of various private payers and public programs. But doing so would run up against powerful stakeholders who make their money on these administrative tasks. After administrative costs, prices are the next largest area that the JAMA study identified as waste. The author's estimate for this is $231 to $241 billion per year on prices that are higher than what would be expected in more competitive healthcare markets, or if we imposed price controls common in many other countries. The study points to high brand drug prices as a major contributor. Although not explicitly raised in the study, consolidated hospital markets also contribute to higher prices. A variety of approaches could push prices downward, but it could also decrease investment and innovation. Likewise, studies show that when hospitals are paid less, quality can degrade, even leading to higher mortality rates. Other categories of waste examined by the JAMA study encompass inefficient, low value, and uncoordinated care. Together, these total still at least $205 billion. With more than half of medical treatments lacking solid evidence of effectiveness, it's not surprising that these areas add up to a large total. They include things like hospital-acquired infections, use of high-cost services when lower-cost ones would suffice, low rates of preventive care, avoidable complications and avoidable hospital admissions and readmissions, and services that provide little to no benefit. In addition to wasting money, these problems can have direct adverse health effects, lead to unwarranted patient anxiety and stress, and lower patient satisfaction and trust in the health system. Here, the study's findings are relatively more optimistic. It found evidence on approaches that could eliminate up to half of waste in these categories. The current movement towards value-based payment, which is promoted by the Affordable Care Act, is intended to address these issues while removing their associated waste. The idea is to pay hospitals and doctors in ways that incentivize efficiency and good outcomes, rather than paying for every service regardless of need or results. Putting this theory into practice has proved difficult. So far, only a few value-based payment approaches seem to produce savings, and not a lot at that. One of those approaches involves single payments to hospitals and doctors rather than paying for individual services. There is evidence of savings from some bundled payment programs. These provide a fixed overall budget for care related to a procedure over a specific period, like 90 days of hip replacement care. Accountable care organizations also seem to drive out a little waste. These give health groups the chance to earn bonuses for accepting financial risk and if they reach some targets on quality of care. The final area of waste addressed by the JAMA study is fraud and abuse, accounting for $59 to $84 billion a year. As much as politicians love to say they'll tackle this, it's a relatively small fraction of overall healthcare waste, around 10%. More could be spent on reducing it, but there's an obvious drawback if it costs more than $1 to save $1 in fraud. Because healthcare waste comes from many sources, no single policy will address it. More important, we have evidence on how to reduce only a small fraction of the waste. We need to do a better job of amassing evidence about what works. Hey, did you enjoy this episode? You might enjoy this other episode on low-value diagnostic imaging. It also helps if you subscribe and like below, and also if you go to patreon.com/healthcaretriage, where you, like our research associate Joe Sevitz, and of course our Surgeon Admiral Sam, can help make the show bigger and better.